these days in India, you're never quite sure whether you'll be praised or being said bad words, because if the patient doesn't survive, then you bear the brunt of it. Have you had an experience like
A
that?
lot of experience. See, only not about survival. I'll tell you, patient wants, according to them, patients or the relatives, especially the relatives. It's like first they come and they surrender. This is a problem. What should be done? So we see and tell, okay, this has to be operated or certain treatment. How much? First the comes
cost.
majority of Indians, or like in our scenario, they are not insured like a national insurance or a government. What they do is they keep doing window shop, and they waste the time where the disease progresses.
Oh, okay.
And they come, no sir, you told last time that this would be done, so now do. But they expect the same result what should be at that point of time. Okay, we do it. Some residual things remain. Okay, I cannot give 100%, but at least I will be able to, I am giving you 90% results. They start judging you, no sir. It
You are not
went well,
capable.
but that 5-10% sir, it is there. Then they start judging the way the theatre operator, where there is no place to sit. They'll keep judging you on non-medical issues.
Okay.
They'll keep judging you at the time of discharge. Okay, sir, how many days I need to be rested? Oh, so I cannot go for job. No, sir, I have a function to attend. The priority of the patient, it's like, I'm not blaming, but that is the mentality of the people. So that's why we don't expect that he should present. We only, if you don't give us a bad mouth of publicity is also enough. We take this as appreciation. And last come the finances. Then they come and ask for the bill. Everyone, no, sir, this is too much. And they start bargaining. See, you can just imagine how bad it feels. If we are playing with your life and we are giving you a better life without compromising any medical technology. You want a best operation theatre, best surgeon, best equipments, best consumables, but you don't want to pay for it. But certain things, we need more blood. Sometimes we need more equipments where we need to open and do, because we on that table or on that moment, at that moment we have to get the patient out. So we don't think, okay, excess of it's going out of budget. We don't think, we just do, and we just say, no, sir, you told us this much. Otherwise, you're a bad doctor. This guy is a commercial. He wants to lure money. And what mentality? All doctors are luteras. Means all doctors are like dacoits. They want to loot money from common people by giving big name. I agree. 5% of our field are very professionals. They loot, or you can say they are bad people. It's in every profession. Just seeing that 5% judging 95% people is not right.
True. You're talking about how people start bargaining about money. In a country where there is no proper healthcare, or not everybody is insured, have you been in a situation where you have to see, okay, this person, I can save him, but I know he will not be able to pay for the treatment? First thing is, have you been in this situation, and what did you do, and how did you decide?
In such situation, we've been many a times, especially when you are bound in a corporate setup or a corporate hospital. You feel that, but okay, we do first aid in any hospital, even a corporate or non-corporate. We give a first aid where any emergency procedure or emergency maneuver can save patient's life at that moment of time. We do that. Even the government norms are strict and humanity based. Any doctor or any hospital, and that, okay, first aid. For example, a patient came with suddenly a vessel or a blood vessel cut and it's bleeding heavily. We just hope in the emergency casualties, we just tie it or fix something where we can temporarily hold and save life. But the definitive procedure in corporate hospital, you have to send the patient. The patient is not willing. But in where for being this reason, I have cut myself from the corporate setups where someone cannot dictate me, or someone cannot guide me or command me what has to be done and not. In a smaller setup, many a times where we have done without cost, without taking money, because patient, if it's not affordable, we cannot go hold his collar and get money. But at least we have that satisfaction, okay, he will pay or not, we don't know. Many a times patient have come back and paid. This situation we go many a times.
Okay.
Many of the time patient, seeing our good intent, our aggression towards intent toward treating him, they have come and paid at least bare minimum, sir, we can afford this much, but thank you for saving us. That gives a next level satisfaction. Even if we can't pay, okay, Almighty God, he's contributing in some other way. We hope in and go forward. That happens. Sometimes you get a positive experience, sometimes a negative experience in monetary terms. But our priority more than money is to give the best thing which he needs or he deserves at that moment.